Our State of the U.S. segment, the Trump administration is stepping up its fight against the opioid epidemic. President Trump unveiled a three-point plan to combat opioids. The goal is to prevent new addictions through education, expand treatments for addiction, and cut off the flow of illicit drugs coming across our nation's borders. So how exactly will his plan be put into effect, and will it work? With me now, board-certified family physician and health policy expert, Dr. Jonathan Vitale. Dr. Vitale, thank you for joining me. What do you make of Trump's plan? Do you think this is an effective approach?
Well, first of all, thank you for having me, Stephanie. Yes, look, I think that this has been a big problem in this country for decades, the opioid crisis. I mean, it started in the 1990s when doctors started paying more attention to pain in patients, and pharmaceutical industries started really marketing opioids. And that's when the prescription rate really skyrocketed, so that now we're up to 250 million prescriptions for opioids every year. What the Trump administration is doing is drawing attention to this problem, which kills over 42,000 people per year. Actually, 115 people per day die from this opioid epidemic. So it's a really big problem that has been ignored for far too long. And I think that this plan that Trump has put forth is a very good start on how we can deal with that.
Yeah, I mean, we never heard from the last administration really much about the opioid epidemic.
That's right.
And so there isn't a lot of discussion on what's going on with this and how they're effectively going to, tackle this. And this is going to cost a lot of money. And I know that they were talking about $6 billion to fund this battle. I don't think $6 billion is going to be enough. Just looking at just any sort of treatment for people that are going through addiction. A lot of the facilities cost $30,000 just for a few month span. And that's just, a few months. Right. So imagine trying to give somebody lifetime treatment. But there's just a lot of discussion about some of the comments that President Trump made during a recent speech. And he said that he, was considering maybe a death penalty for drug traffickers. So is that something that you would agree with?
Well, I think that that's been visited before. I mean, there is in the federal laws, there is a federal kingpin provision which allows federal prosecutors to request a death penalty for certain drug crimes. Hasn't really been implemented. Even if it was, it would probably go all the way to the Supreme Court. But honestly, I think that the death penalty and opioid abuse is a bit of an overreach right now. We really should be focusing on preventing more opioid addictions and also reducing the amount of opioid prescriptions in this country, and really cracking down on those folks who are smuggling drugs across our borders, and also the doctors who are running these pill mills. I think that we need to focus more on that, make some harsher criminal penalties. But I haven't seen a lot of good evidence that the death penalty necessarily is going to reduce the amount of opioid addictions.
Yeah. And how do we even get here in the first place? So a lot of people have taken opioids, after a surgery or something, and then people stop taking it and they're fine. But then there are other people that just become so dependent. And so what is the difference between somebody that can just put it away and be done with it after their recovery, and then everyone else that is going through all this trouble and addiction? What's the difference?
Yeah. Yes, there are some genetic predispositions to folks who have addictions or addictive personalities. I mean, one of the problems with the opioid crisis is that a lot of young, healthy folks, for instance, who may have had a dental procedure or maybe a shoulder procedure or knee surgery, go home with a 6-week supply of opioids when they may have just needed a few days of ibuprofen or maybe just a few days of opioids. And so what happens is these medicines sit in the cabinet, and they may not be able to stop taking them after a few days. They may have a highly addictive personality, and then they can easily go down that path of becoming addicted to opioids. The doctors may cut them off, and then they unfortunately go to the streets in order to get these opioids. So it's a really big problem in this country, and we really need to start educating doctors on how to better treat pain, and also to make sure that opioids are not the first level or the first line of defense against pain in this country.
Yeah, and my understanding was that, we saw this crisis expand after the passing of Obamacare, because a lot of doctors, didn't want to go through with the surgery. Instead, they were giving people prescription pills to save money.
Sure. Yeah, I mean, that's multifactorial. With Obamacare, you had everything from the government giving hospitals bonuses based on the patient satisfaction scores. So it's easy to make a patient satisfied by giving them more opioids, but that isn't necessarily going to make the patient healthier. And that's one of the things. The other thing is, yeah, I mean, folks on these expanded Medicaid plans can go into a pharmacy if they get a prescription from their doctor and get large amounts of opioids, which sometimes end up on the streets. And then also some people have deductibles and copays and premiums that are too high, so they're putting off these surgeries, and instead they're trying to treat their pain with medication. I mean, a big thing in medicine is you always want to treat the cause, not just the symptom. When you start just treating the symptoms, such as the pain from your knee problem, instead of treating the knee problem, you start going down a very slippery slope.
Yeah, absolutely. And this is a very deep issue, and it's not 5 minutes isn't enough
Yes.
to get across every single point, but we're going to have to leave it here.